Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Winn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello and welcome to this edition of the Healthcare Connections podcast. I'm your host, Jeremy Winn, the Director of Sales here at Healthcare Compliance Pros. Excited to introduce you to another great guest today. I've got Kevin Baker. He is the Director of Corporate Development at Emergency Care Partners, or otherwise we call him ECP around here. So you may have heard of him both ways. But Kevin, thank you for joining the podcast today.
Thanks, Jeremy. I appreciate you having me on.
Absolutely. Why don't you give our audience a more thorough background of yourself, your journey, prior to ECP, and really what you've been doing up to this point.
Yeah, that sounds great. So I've been with Emergency Care Partners, or ECP, as you mentioned, now for about 16 months. I joined in July of 2024. And as you mentioned, I've got the extreme privilege of serving on our business development team here at ECP, where I really focus on supporting the national growth objectives of the company. And so the place where I operate the most right now is in new physician practice partnerships, where I connect with emergency medicine partners across the U.S. to try and better understand some of their pain points with managing their own independent practice. And there are a lot. And if we have the right mutual fit, going down the path of formally partnering together. And so prior to ECP, I worked at a regional gastroenterology group based here in the Northeast, where I oversaw a handful of GI practices in the New York metro area, supporting them from an operations and a finance perspective. And then before that, I was at a national nephrology platform where I supported our M&A and value-based care growth efforts. And that was a specialty that was and is kind of growing very quickly today. And prior to that, I spent about 5 years at a national surgery center business where I sat on the finance and corporate development teams supporting growth efforts predominantly in the Pacific Northwest. And then I started out my career working at a boutique M&A advisory firm in upstate New York, really that focused on advising small and medium-sized businesses on buy and sell side M&A, business valuations, and some strategic consulting work. So I've been in the healthcare services space now for about a decade, and it's just been a great place to learn and support our healthcare ecosystem. And I've grown quite passionate about supporting operators in this space.
Love that. Yeah, lots of experience, lots of different specialties you've been around. That's why I was excited to have you on. So 16 months at Emergency Care Partners. Maybe talk to us about ECP specifically, some of the things that to make you unique, and really, for those that aren't familiar with your group, I think that'd be wonderful.
Sure thing. So ECP, we are one of the largest single specialty emergency medicine practices in the country. And so we were founded back in 2018 through the foundational merger of two independent EM groups, emergency medicine groups in the state of Louisiana. And so we're a relatively younger organization, but this is what really launched ECP. And so fast forward to today, we are now a consortium of 11 independent emergency medicine practices across 9 states. And we are incredibly grateful and privileged to be able to serve just south of 2 million patients per year across 65 plus emergency departments across our footprint. And so we've really had a great experience partnering with EM groups and EDs across the country of all shapes and sizes across the US. And we truly believe there can be a really good thing that happens when we come together to share resources, share human capital, share financial capital to support our health system partners and our patients to the best of our ability. And so each new partnership that we engage in has a lot of uniqueness. And one of our big mantras here at ECP is that medicine is local. And so the players, the payer mix, the competitive dynamics in New York City, for example, look very different from Dallas, Texas, or even out in Utah, out in your backyard.
Yeah.
And so,
Yep.
we're really proud of where we've come as a company and a community of emergency medicine groups and providers. We're not the largest out there, but we're not the smallest EM group either. And so we really kind of pride ourselves with partnering with groups with similar cultural and business values as us. And so our goal here at ECP is really to partner with groups with great reputations that produce great results from a clinical quality perspective. And so that's a little bit about ECP.
Love that. So you touched on this a little bit there towards the end, but as you're going out, building relationships, looking for new partnerships, what does the typical group look like? Are there regions of the country you're looking into? Usually, there's lots of different criteria and things that really fit the mold. So talk about that a little bit.
Yeah, whenever I get this question, I love to talk about kind of the motivations of why people decide to partner with us, and there's various motivations of why a shareholder in an emergency medicine group may want to explore options of partnering with ECP. First and foremost, and I'm going to use a bad dating analogy here, but it's really important that we get to know each other before we get married, and to really understand if we're the right fit for each other. And so we won't be the best fit for every emergency medicine group out there. And so
Yeah.
understanding each other's values, each other's culture and vision really goes a long way, at the exploration phase of any discussion. And so I like to bucket, the primary motivations that I typically see with groups that we talk to really into kind of three buckets. The first is liquidity. So whenever we partner with a new group, the owners of that emergency medicine group are able to monetize the earnings of their business upfront today at the time of partnership. And so, this allows older docs to feel financially secure, mainly from the practice that they've built, through sweat equity or putting up their own capital that they've built for the last 20 to 30 years, right? And so it's really important for them. It allows younger partners to reinvest that capital elsewhere, right? And to earn a higher return elsewhere where they want to. And it also supports succession planning of the group. And so supports that succession planning by passing the baton to the younger employed physicians who will now have an opportunity to own something much larger and be diversified. And so diversification is really key. Owning in a business that manages 65 plus emergency departments in 9 states across the U.S. has a very different risk profile than if you just managed a single site ED group elsewhere in the country. And so that's a big part of our value proposition. The second bucket is really operational support to maintain existing strong operations. And so one of the big key pain points that we hear from physicians is, I'm spending too much time on the administrative side of healthcare, and I want to get back to seeing and treating patients. And so we allow and fully support unencumbered clinical autonomy across all of our practices, and that does not change, right? And so ECP, we also provide a pretty robust offering of various back office services, including, revenue cycle management, payer contracting, independent dispute resolution, finance, accounting, operations analytics, recruiting, med-mal, and so on. And so given the size and scale of ECP, we're often able to do this, at a much cheaper cost than a smaller emergency medicine group might be able to. And so we're able to kind of achieve some economies of scale for some of our new partners also. And then the third and final big motivator that I see is they're looking for someone to just be able to support their growth objectives. And so some of the best partners that we've had are just very aspirational. They want to grow, but growth can be expensive and it can be difficult to do on your own without some wind in your sails. And so this is where ECP really excels. We support all of our groups with financial and human capital to grow where they want to grow and to ultimately reduce some of the execution risk for that growth. And so as I alluded to earlier, capital to grow can be expensive to obtain, and it can carry a lot of risk with it. You as a partner in an emergency medicine group, if you want to grow and expand within your existing health system partnership, you only have a few options, right? You can either fund that growth yourself and come out of your own pocket. You can go to a bank and take on debt and personally guarantee that debt, perhaps, or you can enter in a partnership like ECP. And so all of those options have different trade-offs, but this is kind of one thing that our partners really enjoy about ECP. And so,
I love that.
one of our mantras here at ECP, another one of our mantras is that we offer, all the resources of a big box company and all the benefits of a private practice model. And so, we're big proponents of doing what we say. And so if you head to our website, what you'll really see, what you'll see is this mantra really in action. You'll find, and it's also in my email signature, a list of logos, right? And these logos are all the groups under the ECP flag that partner with us. But more important, each brand and each logo is retained locally. And so that local leadership, that the local providers, the local reputation mean more to hospital leaders and patients than anything else.
Love that. The thing that I really love about your model, that you alluded to, and we hear it all the time as we meet with physicians who are owners in their practice, and they want to stay, autonomous, as like you said, and they tell us all the time, I went into medicine to treat patients and I want to take care of patients. And so they'll come to us and say, please just take the compliance off my plate, because I didn't go into medicine to try and manage HIPAA, OSHA, and all the elements that OIG is asking me to do. And that's what I love about your model that you mentioned, how they can stay autonomous. They can really focus and keep their practice feeling like a private practice, and yet not have to worry about the administrative burden that oftentimes takes way too much of their day and their week, and they can focus on patients. I think that's powerful.
Yeah.
So last few minutes here, I'd love to have you talk about some of the trends that you're seeing, some of the hot topics when it comes to emergency medicine.
Yeah, absolutely. So there's, in my mind, there's really three big major themes in the field of emergency medicine that are really trending right now. The first is the boarding issue, right? I mean, there are more than 100 million ED visits each year in the U.S., and so you can imagine how much stress this high demand really puts on our healthcare system. Emergency departments nationwide are overwhelmed with patients waiting for inpatient beds, and so lots of times this can be an issue of bottlenecks within the four walls of the hospital, where admitted patients just can't get discharged quickly enough. But ultimately, this is a very complex, multifactorial issue that it's not an easy solve. It's not an easy solution.
Yeah.
The second is, there are some fallouts with the implementation of NSA, or the No Surprises Act. And so, the federal No Surprises Act really changed the out-of-network game for many providers in our industry. And so there's been a lot of documented flaws with the implementation of NSA. And this has real implications on independent emergency medicine groups. And so, we've seen, for example, evidence of payers kind of systematically underpaying or delaying payment that is rightfully rewarded to emergency medicine groups. And, it's not right. The third big trend that I'm seeing right now is really just a negative reimbursement trend. And so this is probably old news to most people familiar with the healthcare sector, but the CMS final rule for 2026 came out recently, and we're expecting Medicare payments for ER visits to go down year over year yet again by about 1% next year. And so that 1% doesn't entirely fall the bottom line, because there's some commercial pay in there and other payers, but it doesn't help, especially when labor and insurance inflation is running rampant, right? And so another thing that's unique in the emergency medicine specialty is a federally unfunded mandate called EMTALA, which basically says you as an ER doc, you have to see every patient that walks through that ED, regardless of their ability to pay. And so the shocking statistic that I've heard recently is, on average, 1 out of every $5 of money that's owed to an ER doc goes uncollectible, right? So 20% just goes to bad debt. And so, in this specialty, every nickel matters. And so having a partner like ECP that understands the nuances and can scrap for every little cent that's owed to our groups and support that RCM process can really go a long way.
Love that. That's Yeah, that's a shocking statistic. 20%. That's really really high. So, for those that are listening and interested in talking further with you with the team about a potential partnership, or just really wanting to get some more information as they're exploring probably several options, what's the best way to connect with you?
Yeah, so I would encourage anyone who wants to learn more to head to our website at www.ecp.net and head to the Learn More section near the bottom of the homepage on our website. All of those inquiries go straight to our team, and we can get connected directly that way. I'm also very active on LinkedIn, so maybe we can
Mhm.
leave a link, to the profile in the show notes, maybe for viewers. But either channel works to get connected.
Okay. Awesome. Kevin, thank you so much. Really good information that you shared today. And congratulations on your continued success as over there at Emergency Care Partners, and wish you the best of luck as you continue to grow and partner with many great groups around the country.
Thank you, Jeremy. Really appreciate you having me on.
Absolutely.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwin@hcp.md. Don't forget to tune in next week. Thank you.